Hi guys! In this video I'm going to discuss PRP injections and what they are useful for. So we're going to look at how they create the PRP solution or the platelet-rich plasma solution that they inject into you. We're going to look at how they prepare it, what factors can influence how effective it is. Then also what the research has shown, what conditions is it useful for and which ones it doesn't really work for. And then lastly, when you should maybe consider getting a PRP injection, when can it be useful? So my name is Maryke. I'm a physiotherapist from sportsinjuryphysio.com, where you can get online physiotherapy assessment as well as treatment for your injuries, all done via video call. Have a look at the description of this video if you want a link to my website. Okay, so let's jump right in. How do they prepare the PRP solution? So PRP stands for platelet-rich plasma. And it's your own blood that they draw, then they spin it really fast, and by spinning it, they separate the blood into different layers. Because remember, you've got loads of different cells in there, and different things that some of them they want, others they don't. And what they're looking for is that little layer of plasma that has a concentration of your platelets in it. And that's the level that they draw off. Now, I do apologize if you're hearing a lot of banging, but they are building next door and I can't do anything about it. So they then take this layer of plasma that's full of your platelets and they draw that off and they inject that into your injury site. Now, why do they do that? So platelets has the ability to secrete to secrete loads of things. So some of the stuff that it can, why do I want to say release is the word I'm looking for, not secrete. One of the things that they release is growth factor, and growth factor, there's loads of different types of growth factor that they actually release, and that can stimulate the healing process, especially that of collagen. And collagen is the building block of loads of musculoskeletal structures, tendons for instance as well. Then they also release pro-inflammatory and anti-inflammatory substances, and that can help with pain management. So in essence, PRP is used either for pain management, but mostly to stimulate healing in structures where healing has either not taken place or where healing is really slow. Now, there's a load of different factors that can affect how well your PRP injection works. Because when we get to the research as well, you'll see that there's a lot of studies that show that PRP is really effective for some conditions, and then there are quite a few studies that shows it doesn't really work. And the reason for this is, depending on how, it's twofold. Part of it depends on how they prepare the solution. Part of it depends on the patient themselves. So with regards to how they prepare the solution, that can dictate how many platelets is actually in the substance that they inject into you. And it can also make a difference to how active these platelets are, because just because you've got platelets that's being injected into you does not mean that they're actually going to release the substances you want them to release. At the moment, there's more than 16 different machines that they can use to prepare your PRP solution. And what the research has shown is each one of these machines creates a solution with a different concentration of platelets in it. Then also, they can either spin it once or they can spin it twice, and that will have an effect. Then they also sometimes add substances to it that allows the platelets to release their bioactive components more readily. And you can use different types of substances to stimulate them. And with some studies, they just don't use anything either. Then what else can be different? Oh yes. So they often and usually inject anesthetic into the site where they're going to inject the platelets for you to help with the pain management. But what they've shown in the research is that anesthetic can actually have an effect on the platelets that they don't work so well. So depending on how much of the anesthetic they inject, that can have an influence on how well the injection works. Now, we just don't know at this point what the best way to prepare and inject these things are. There's no clear-cut solution to that yet, or clear-cut guidance. So there's a lot of room for improvement in the research with regards to procedure. Then there are also factors in the patient themselves that can affect this, because the interesting thing is, even in studies where they drew the blood from the same patient and prepared it in exactly the same way, it had a different effect on different days. And that's because depending on what you eat, what you do, you can affect how many platelets you have and how well they function, or how much substance they've got left to release. So things that can influence it is, interestingly enough, mental and physical stress. Now, when we talk about mental stress, it doesn't even have to be massive mental stress. It's the stress you feel when you have to speak in front of a lot of people, or when you've got to do a maths exam. What happens then is that your platelets release their substances into your bloodstream to help you with what you've got to cope with at the moment. So if they then shortly after that go and draw your blood and prepare your platelets, those platelets don't have as many growth factors or other bioactive components to release for your injury. So you're essentially injecting starved platelets into the injury site, which can't have the best effect. Same thing for physical stress. Physical stress is not even that extreme, it's just a bout of exercise. So you can see, if you due to have a PRP injection, it may be worth limiting those type of stresses a few days before they draw your blood. Then other things that can influence it is if you have a diet high in saturated fats and sugar and simple carbohydrates. That's been shown to affect how well your platelets function. Caffeine has an influence on it. Also, certain flavonoids that's present in things like onions, apples, tea and wine. Similarly, substances present in legumes like chickpeas and soya beans. Then alcohol, as well as smoking, has a very negative effect on platelet function. And also certain medications, of which some of the main ones that a lot of us use are anti-inflammatories, so non-steroidal anti-inflammatories, antihistamines that people use for hay fever, for instance, and also certain antibiotics. So, and at the moment, patients aren't really being given guidelines with regards to managing these things before they go for a PRP injection. So again, that can be part of the reason why the research is showing such varied results, and that it works for some people and it doesn't work for other people. So there's a lot of scope for improvement with this technique. Okay, so then we get to what conditions the research is currently showing PRP to be useful for. So at the moment, the guidelines are saying greater trochanteric pain syndrome, also known as, so it's pain around the lateral hip, usually caused by gluteal tendinopathy, so glute med tendinopathy type thing. The research is showing that, yep, PRP injections can be useful for these conditions. Patellar tendinopathy, plantar fasciitis, tennis elbow, then also osteoarthritis of the knee, because if we think of osteoarthritis, you're getting permanent and non-healing injuries of your cartilage and stuff, and the PRP can actually help with the pain you feel from that and repairing that a little bit. So for those conditions, it's been shown that if you add PRP to the treatment process, so not PRP on its own, but combined with rehab processes and things like that that you would normally do, you get better results. Now, there's limited evidence that PRP may be useful for rotator cuff tendinopathies, osteoarthritis in the hip, then also sometimes when you have an ACL or anterior cruciate repair and they use your patellar tendon to do that, patients can get a lot of pain on the patellar tendon where they've taken that part of the tendon, and PRP seems to help with that pain in that patellar tendon. Also for high ankle sprains, so syndesmosis injuries, that PRP can help repair that type of injury. Now, conditions that the current research is showing that PRP is not useful for, surprisingly, Achilles tendinopathy. So even though it helps all the other types of tendinopathies, at the moment, it doesn't seem to be helpful for Achilles tendinopathies. Also, if you've had an acute fracture or you've got a fracture that doesn't want to heal, PRP doesn't seem to be useful for that. Some surgeons have been injecting PRP solutions when they do repairs of like cruciate ligaments or rotator cuff repairs or tendon repairs in the hope that the PRP will stimulate that repair to help it heal better and more quickly. And the research is showing that nope, PRP doesn't actually help that either. So I won't say that you need to close the door totally on these conditions and that it will be, like for instance for Achilles tendinopathy, it may just be that they haven't perfected the technique with Achilles tendinopathy yet. So we'll keep an eye on the research. It may be as they get better with doing these types of injections and preparing the solution that it does become useful for them. So when should you consider having a PRP injection? Usually, if you've tried at least 12 weeks of a proper progressive rehab program and you're just not making progress, or the pain is preventing you from actually starting your rehab program, then I would say PRP is something that you could consider and discuss with your doctor. It's not a magic fix, and it still needs to be used in combination with rehab, for instance, for gluteal tendinopathies and other types of tendinopathies and stuff, because you need to still strengthen that tendon and stimulate it to heal further, but it can be a very good adjunct to treatment. So let me know if you've got any questions. If you need more help with the injury, you're also welcome to consult me via video call. Link to my website is in the description of this video. Take care.